So today's video is going to focus on fractures and osteoporosis. And those are going to be really the only two kind of bone things that we're going to focus on when it comes to like injuries and disorders. So our first focus is going to be on fractures. Fracture is any kind of break or crack in the bone. So breaking a bone is the exact same thing as a fracture. A lot of people have a misconception that a fracture is only an incomplete or maybe like a partial break, but that is not true. There are varying grades of fracture, and any kind of break is a fracture. Your two basic classifications of a fracture are simple or compound. And as you can see in the picture here, your difference is they're both fully broken. Your difference is the skin. A simple fracture is also called a closed fracture, where a compound fracture is also called an open fracture. Your biggest concerns with these is that your open fracture now has an open wound. So while they both involve a break of the bone, your compound fracture is going to have more soft tissue damage because it tore through the muscle and the skin, and it has the open wound concern, which is an issue for potential infection, scarring, that kind of thing. Okay, our next slide is going to contain some pictures. So if you find those a little off-putting, or if there's somebody around that might get super grossed out, like maybe a younger sibling, make sure that you're, just kind of being aware of that. So these are all examples of open fractures. This top one here is going to have significant potential here for infection because the ends of the bone, right? This is the marrow there on the bone. There's an entire piece of bone that is missing here. So the ends of the bone are exposed, and there's all that potential open wound there for infection. Okay, the one up here on the top where the basketball player has fallen, that is actually their tibia. Their knee is way back here. So basically, what happened with this guy is he was just walking and he fell, and it basically his leg gave out on him. And then, as you can see down here, we have a dislocation with an open wound. So these would all be compound or open fractures. And then if they were what we think of as a more typical fracture that doesn't break the skin, they would be a simple or a closed. All right, if you close your eyes during the gory parts, open them back up. All right, so this is, we're going to look at a wide variety of fractures here. And so you guys are going to be looking at all these different fractures and some characteristics of these fractures. We'll look in the video in a second. We'll look at some X-rays about what these fractures would look like on X-ray. And then in class, we'll also look at some X-rays and see if you can diagnose some fractures. So the first one here is this comminuted. That's an N right there. Okay, so the comminuted fracture, the bone itself shatters. So you can see this bone here is in a bunch of different little pieces. Okay? This becomes a little bit more difficult to repair because you have all the different pieces. You can't just line the ends of the bone back up and have them essentially grow back together. This may require some hardware to put this back together, some surgical repair, and depending upon the amount of shattering and how fine and how small the pieces are, like I said, it may require some hardware to replace some of them. Your second one here is called an oblique fracture, which looks very similar to this one on the bottom here called a spiral fracture. Both of these are going to come across the bone at an angle. The difference will be the force that is applied. In a spiral fracture, there has been a twisting force. You can see from the arrow here. So there has been a torque or a twisting force that has caused that fracture. These spiral fractures a lot of times have some soft tissue damage associated with them because these ends of the bone here can be pretty sharp. These are the kinds of fractures you see in, for example, in soccer players when they plant and then they turn and their foot stays planted, but the rest of them kept turning, right? So that twisting or that torquing motion is what causes that spiral fracture. An oblique fracture is not caused by the twisting or the turning. There's basically been a force that has been applied at an angle. So it has caused this break here at this oblique angle here. The third one across the top here is this green stick fracture. So if you'll notice with the green stick fracture, it doesn't go all the way across the bone. It is what would be considered an incomplete fracture. And these are more common in children or in kids because their bones are more flexible. This is actually called a green stick fracture based off of the fact of a young tree, like a sapling, where the branches are growing, right? You can bend it and maybe part of it will start to break, but it won't break all the way through. As you can see right here, the end is still intact. And so because children's bones don't have quite the mineralization as adult bones do, they sometimes don't break all the way through. And so that would be an example of a green stick fracture, again, significantly more common in children. Our fourth fracture across the top here is this compression fracture. This is a common fracture due to osteoporosis, and we'll look at that in just a second. Sometimes called, you get what's called a pancake vertebrae. These are common in the spine, and essentially what happens is what you see happening here. This is a full vertebra here, and then you can see how this one here, they are being crushed or they are being compressed. And these are common with osteoporosis because with osteoporosis, we're losing bone density. And so our spine bears a lot of weight. And so that weight can eventually crush the bones if there is not enough bone density there to support them. These are the kinds of fractures that can cause the hunching or that hunchback that you see sometimes in elderly people that have significant osteoporosis. All right, we're going to keep looking at these. I know I'm talking very quickly. Remember, you can pause and that kind of thing. Okay, and again, you're going to need to be able to recognize all these different kinds: comminuted, oblique, green stick, compression. We've done spiral. So looking down here on the bottom left, we have an avulsion fracture. This one is specific in the sense that it's a calcaneal, so it's telling you it's on the calcaneus, which is our heel bone here. But the type of fracture that we're looking at here is an avulsion fracture. And what you'll notice with this fracture is that a piece of the bone is pulled off with these kinds of fractures. So these are common in places where, muscle anchors into bone. That's how muscle is able to pull on the bone to cause movement. Okay, so these are common in places where maybe where the quadricep tendon attaches just below the knee, or here in the calcaneus, the big, large, strong Achilles tendon. Sometimes in where the bicep tendon attaches down onto the forearm. But essentially, these are usually because there's so much stress being put on that area from the muscle and tendon, and a piece of the bone shears off. And that is going to usually that's definitely going to require surgical repair because the muscle won't stay stretched out to let the two pieces of the bone heal together. You'll have to put some hardware in there to screw that back together, and maybe that hardware can be removed later, but that is definitely going to require surgical repair. All right, so we already did a spiral. The next one here is kind of small. So these are our stress fractures. These are sometimes called hairline fractures. They can be hard to see on X-ray sometimes because they're going to be really thin, really small. You may not even see them in the X-ray. They'll be painful, but a lot of times the patient can still move and still function. They may have a stress fracture in their foot, and while it's painful, they can still walk around. They're still moving. These are usually due to an overuse injury. The example here in the lower leg and in the foot, that would be common in, for instance, a runner who is putting a lot of stress into their feet, into their legs from the running motions, and they can get these hairline fractures from overuse. Okay, the last one that we're going to look at here is what's called an impacted. So an impacted fracture here is where the pieces of the bone, so the bone has broken, right? So the bone is broken and the piece of the bones have been smashed into one another. If you look at this example here, you'll see how there's no gap, there's no space, there's no opening between the bone because this upper end of the bone or the lower end of the bone has been smashed up into the other one. These may require some traction to pull them back apart some so that you don't end up with something shorter than the other or it healing awkwardly. And these are common in, like, for instance, in the arm in a fall injury. If you fall and stick your arms out in front of you and maybe the bone is already weaker and there's a significant force shoving one end up into the other. You see these sometimes in car accidents where you're sitting in the seat, so your knees are bent and the dashboard collapses down onto the legs, shoving the femur backwards. So that can break the femur and impact it. But again, these impacted fractures could require traction in addition to possible surgical intervention for them to heal properly. Okay, so looking in these X-rays, if you'd like to check yourself, go ahead and pause it and see if you can figure out what these all are. So A here, you'll see that I've got a bunch of pieces of bone here. This is a femur and this is a tibia. So what you're looking at here is a knee. And so I have a bunch of pieces of bone here. So this would be an example of our comminuted fracture. And let's see, let's look at B here. So B, this is the vertebra here. Okay, so that's a full vertebra here. This is this vertebra here that they're looking at. So this is a compression fracture. You'll notice how this bone is more white looking. So it shows that the bone is a little bit more dense. You can see almost what looks like gas throughout this bone here, showing that loss of density there that can cause that to collapse down. Okay, in C here, we have a bunch of small fractures. They're a little bit harder to see. This is a foot, and so these are stress fractures, again, due to overuse. Okay, so again, we have this is another leg, lower leg. This is a tibia in particular. We have these very pointy ends of the bone here. So we need to be thinking oblique or spiral. And the patient's history would help you tell, as well as the fact that essentially this top part here is almost like falling off of the bottom part. And so that is going to be a result of that twisting torque kind of force. So again, pause and try to see if you can figure them out. And I'm going to run through them quickly. So when you've hopefully figured them out, unpause it and check yourself. Okay, so this right here, you can see that wider line right there. This is an impacted fracture. That neck should be more like this. And then you see the rest of the femur coming down. So the neck of the femur there has been crushed up into the pelvis area. So in F here, you'll see the fracture right there. It is only coming across right here. So it did not go all the way through the bone. So this would be a green stick fracture, commonly in a child. And looking down here at G, this is not a fracture. That is your kneecap or your patella. Okay, but this right here is a fracture. And so you'll see a piece of the bone has been ripped off. So this would be an example of an avulsion fracture. Okay, so let's look at what happens in your body as your body tries to heal from the fracture. Remember, bone is a type of connective tissue, meaning that it has a really good blood supply. We don't really think of that because we think of bone as more being a solid thing. But remember, bone is a living tissue. It is dynamic in the sense that it is constantly changing. Your bone is not static. You may have heard that one of the best things you can do for your bones is weight-bearing exercise, because weight-bearing exercises pull on the muscles, which then pull on the bones. And so our bone lays down more bone to help support those stronger muscles. Okay, so our bone is constantly changing. Remember, think back to your first video with your osteoblast, osteoclast osteocytes, your different cells that break down and build up bone. So when the bone is fractured or broken, the first thing that's going to happen is you're going to have a hematoma form. This is essentially a big inside bruise. Okay, so a hematoma is a big bruise. And so we're going to write it like this, right? We have a lot of bleeding that is occurring because, again, connective tissue has a really good blood supply. So there'll be lots of bleeding that occurs. That's mostly what causes the swelling that will occur around the fracture site. Okay, the second step is going to be to lay down a fibrocartilage kind of framework or network. That's the callus that's being laid down. So it's essentially like you're building the initial, you can see it in yellow here on this second picture there. That fibrocartilage starts to bridge the two pieces of the bone together. This is what's happening when you're first, for instance, in the cast or immobilized, though. There's no strength here. You can't put, pressure on it or anything because that will cause that fibrocartilage to break. But what it's doing is it's allowing the framework for it to eventually become mineralized. So from that fibrocartilage callus, now you're going to start to lay down the actual bone. Just like in the fetal skeleton, it starts with cartilage. It's all hyaline cartilage. And then it starts to get remodeled and replaced with bone. So we start with the fibrocartilage, replace it with bone, and then over time, the bone will remodel to what it used to be. So this can be happening for months after the fracture. A lot of the bone remodeling is happening after you've come out of the cast, that kind of thing. So that's going to be an ongoing process. But you'll see how there's a little bit of extra bone that's laid down here to make sure it's firm, it's secure, and in that area of bone will be just as strong, usually stronger than it was before the break. So it's important that we get these 4 steps down and we get them down in order. Okay, so let's talk osteoporosis for just a minute. So with osteoporosis, we have a low bone mineralization, which is going to result in low strength. We need to keep in mind, again, remember that bone is a connective tissue. And so bone as a connective tissue is going to consist of those fibers, mostly collagen, and it's going to consist of ground substance. Those collagen fibers in themselves inherently are not super strong. They're actually super duper flexible. Okay? And what makes them strong and what we think of as bone is when they are mineralized. So when those minerals attach to those collagen fibers, that's going to bring that extra strength into that bone. And so with osteoporosis, those minerals are being stripped off. And so the bone is losing some of the hardness that it had. And it's becoming more just the fibers. It is more common in elderly women. There's a couple of different types, but just in general, it's more common in elderly women. Some of that is going to be due to the hormonal changes that women see as they age. It'll begin as osteopenia. Osteopenia is just osteoporosis without fracture. So I still have the decrease in bone mass, but thankfully I'm not suffering fractures yet. It becomes osteoporosis when we start having those fractures. So the 2 types are, we have a type 1 and type 2. So our type 1 is our post-menopausal, right? So post is after. So after menopause. So this is going to be in females only. And this is going to be due to those hormonal changes that are associated with menopause. So it'll usually show up about 15 years post-menopause. So mid to late 60s, early 70s. And so those hormonal changes, in particular, the estrogen changes that women have when they go through menopause, can cause a decrease in the bone mineralization. The second type, type 2, is strictly associated with age. So it can be seen in males and females over the age of 70. Okay, so the last thing that we're going to look at here are some visuals associated with osteoporosis. So you can see in this first one here, some healthy bone compared to the osteoporotic bone there on the right. You'll see the difference in the air pockets, the amount of mineralization. The osteoporotic bone has significantly less mineralization than the healthy bone does. This bone, you can see how it could be weaker and easier for it to fracture or to break and not be quite as strong. We can see on the bottom here in this MRI, you can see these compression fractures that have formed there, where the vertebrae, when they collapse like that, will become wedge shaped. And as they collapse down into these wedges, you'll start to eventually see that stooping that you see in people that have severe osteoporosis. As multiple vertebrae collapse down into these wedges, they start to hunch over. Compression fractures can be very painful because there's nothing that really can be done for them. You can't repair them, really. You can't. Sometimes there's some bracing and stuff that can be done for them, but these people are usually pretty uncomfortable, both from dealing with the fracture as well as the uncomfortableness from the muscles and the other bones that are being kind of shifted around to compensate for the fracture. Okay, so like I said, we'll be looking in class at some other various X-rays, having you try to do some diagnosis from those X-rays, and possibly doing some immobilization or splinting a quote-unquote fracture.